Hi friends, my name is Inshaba, and you're welcome to this episode of Light. And today I'm here with Dr. Marilyn Wilson Marbell. And Dr. Marilyn, I'd love you to tell us a bit about yourself.
Okay, so my name is Marbell Wilson.
Marbell Wilson.
Yes, I'm a neurodevelopmental pediatrician. That means that I look after children from the ages of 0 to 18, and then I've subspecialized in what we call developmental pediatrics, which has to do with the brain of the child and how the child develops.
Okay, that's very nice. And thank you, Dr. Wilson, for coming on the show.
You're welcome.
So for this area of our study, we are trying to find out a bit more about autism, because we realize that it isn't really spoken about in Ghana, and it's really on the low. But a lot of families are faced with this almost every time, year in, year out. And I just wanted to ask what exactly is autism?
Okay.
What can you tell us what exactly autism is?
Okay. So autism is one of the developmental conditions that affects children, but it's lifelong, and so both children and adults will have it.
Okay.
It affects the way their communication develops, affects their social interaction development, and then also affects the way they behave. Different things go into the behavior. We look at things like their interests can be restricted or narrow. They can have what we call sensory behaviors, which is the way you perceive the regular senses for them is different, and that leads to behaviors. And then they can also have other repetitive movements. So that syndrome or that collection of these three broad areas is what we call autism spectrum disorder.
Wow. Okay, so from what you said, it looks like a very wide range of things.
Yes, definitely. The core symptoms are the same, and so you have to meet a criteria for us to say you have the condition. However, because it's a spectrum, if you see one individual with autism, it's just one, because they may have varying features, and they will not be the same.
Wow. So I read earlier that you've been practicing for about 12 years.
Yes.
So have you seen an increase in number of cases in Ghana?
Yeah, that's a long-winded answer, because it's not very straightforward. So yes, definitely, I started doing developmental pediatrics proper in 2012. And compared to now, we are in 2024, the number of cases I saw then, over 10 years ago, has really changed. But I think that's a combination of factors. First of all, the advocacy is getting better, and people are learning more about it. So they are not just hiding the kids, or they're just not staying at home. The other thing is that from 2013, the criteria I told you about has been broadened. Yes, so initially before 2013, it was mainly the severe end of the spectrum that was diagnosed. But now it's broader. So a level 1 or a mild autism spectrum will look very different, but they'll be part of the current incidence. So that has increased. But I do think that it has increased. And for me, I think it's more of, I don't know everything. I don't know. I know none of the researchers can tell you for sure. They do know it's increased. For us in Ghana and other places, we believe that the screen time is part of it. So when we say screen time, lots of children are being exposed to screen very early on in life. And the research is definite on the fact that screen affects your social interaction, it affects your communication, and it affects even your attention. And these are core symptoms of autism spectrum. So
screen time early can actually affects a child's development and push
Yes.
them to have symptoms like this because they
Yes.
feel very comfortable
Exactly.
with their screens
Yeah.
and not with people.
Exactly.
Okay,
It won't give them autism though.
Yeah, but like
Yes. So
affects-
we have something called virtual autism now,
okay.
which is not in the DSM-5, which is the
Yeah.
book we use for the criteria. But they look like children who have autism,
Okay.
but they don't meet the full criteria.
Okay.
And once you take away the screen for a couple of months, they do better.
Okay. Wow, that's very interesting.
Yeah.
So, in your practice, at what age do you find parents bringing in their kids? You know, from their personal observations at home, what's the average age you kind of find them starting to walk into your clinic for?
Okay. I think we are quite blessed in the sense that we are seeing the children early.
Okay.
Because it's our niche,
Okay.
everybody knows that's what we do.
Okay.
So a lot of the health practitioners will also refer to us here.
Okay.
So we did some survey recently and we looked at our data from 2015.
Okay.
I started this clinic in 2015.
Wow.
So we had
lovely place. By the way.
Thank you. So we have about 8 years of data.
Okay.
And most kids came between the ages of 2 years and 3 years.
Okay.
So over 60, almost 69% were seen as age 2 or 3. Yeah.
Okay. So, looking at the age they are brought in, do you think it's a factor in the outcome in their development? Do you see massive improvements because of how early they come in?
Yes,
Okay.
yes. So the youngest kid I've seen was 11 months.
Wow.
Yeah, and a couple have been 12 months, 14 months, and they all do pretty well.
Wow.
Because early intervention is key.
Okay.
I mean, wherever you read about autism and intervention, they'll tell you early intervention
It's key.
helps with the good outcomes and prognosis. So the earlier we see them, the better. The brain is
Okay.
still forming, so it's easier to do
Yeah. Okay.
intervention for a young brain compared to the 6-year-old or the 9-year-old. Yeah.
That's very encouraging to know that when they come very early,
Yes.
you can the outcome can be better.
Yeah.
So, Dr. Marilyn, I've been reading on I don't know what it's called, but introducing autistic kids into the regular school system.
Okay, inclusion.
Inclusion, and there's also semi-inclusion. I've read about that and stuff. How is it like in Ghana, and how's that coming up over the years?
Okay, I'm glad you brought that up. So for Ghana, it's a pretty interesting because, as I said, we are young in the whole field, and inclusion. Even though we have policy of inclusion in the education sector, the implementation has been choppy because of the usual things, resources, both financial and human resources and everything else. So yes, we are starting inclusion. There are some schools that are doing it quite well. There are few schools that are doing well. So inclusion would mean that the child, no matter their abilities or disabilities, are being educated amongst their typical peers in their neighborhood, wherever they choose to go to school, but will still get the support in school. So it's a difficult thing to do, but it's ideal. Okay, so we have a few places that are doing inclusion and are trying. Semi-inclusion would be the schools who are accepting children with atypical development or children on the spectrum, but may not have the full cohort of therapists to help them in school. So they accept the parents bringing in their own therapists, or they accept organizations like Mission Pediatrics coming in to help them. So that will be the semi-inclusion.
That's interesting. So still in this, talking about the school system, do you also have teachers who, or maybe the school kind of realizes that maybe this child may be showing signs of the spectrum disorder, and they refer? And how is parents and cooperation?
It's getting better. So initially the educators had a challenge broaching the subjects with the parents. That's your child has come to school, they're not behaving like the other children. Sometimes they were afraid to ask to tell them. But what they've started doing is that they do what they call a developmental screening for everybody. So if your child comes short, then they say, it wasn't us. These people came to screen and they thought this and this and this were delayed. And so it's recommended that you seek more
attention
for the child. So I think that is working. We've been doing that. April is the month for autism awareness.
Okay.
So last year, the last 2 years, we did what we say autism screening in the schools.
Okay.
So we went around and we had a screening tool, and we saw the kids, and those who had red flags or were at risk were then attended to and had further diagnosis.
Okay. So how long does it take for a diagnosis to be made?
Ooh, it depends on where you are. Yeah. It depends on where you are, because basically the diagnosis, there's no blood test, there's no brain imaging. It's observation, interview, and interaction. Okay. So in Canada, where I trained, a diagnosis could take 3 days.
Wow.
So it's multidisciplinary. The neurodevelopmental pediatrician will see the speech therapist, occupational behavior psychologist. Then we meet, have a big meeting, and then we do this. But remember, this is a country where it's subsidized. Everything is paid for. We used to see 3 kids maybe a day.
Wow.
In Ghana, I see like 10 kids a day. And I'm doing this. Even though I have a multidisciplinary team, we don't have the structure where we are going to see, because it has to be paid for. So now what I do is that when I get the referral, most of the time it's coming from either the teacher, another health professional, or a speech therapist. Okay. Most of the time they've done some kind of screening already. So I take that as part of the whole diagnostic setup. When they come, we have an intake for me to be sure that this child really needs a diagnostic assessment. And then it would take maybe 2 or 3 hours to finish the diagnosis. Okay. It would involve them doing a hearing assessment. It would also involve them getting information from the school. Sometimes we go to the school and do observations. Because sometimes when they are here, just an hour or 2, you may not see everything. And the parents may not tell you everything. Because, he does everything well. And you can tell, this child can't do this thing. So then you have to go and observe for yourselves. Usually I can't go. So I send some of my therapists to go. Okay. Then we put everything together before we make the diagnosis.
Okay. You mentioned paid for. I mean, I understand that, especially because it's observational and how rigorous the process has to be able to make a diagnosis. You need a lot of specialists on the job. Yeah. So are Ghanaian parents able to match up, financially? And have you, since you began the hospital, have you had to adjust your, what it actually really takes, to be able to suit the average Ghanaian parent?
Yes, yes, I've had to do that. And that's some of the children who will come in, and within 10 minutes, I know the diagnosis already. I've seen all the criteria. I can check the boxes. Depending on where they're coming from, if I know they can't go through the whole process and the parents are ready for a diagnosis, within an hour, I can give you the diagnosis. And then we start intervention. There are kids who are coming from maybe international schools, they need documentation, or they themselves are fighting the diagnosis. That one, we have to take our time. So that by the time we get to the end of the journey, you yourself can tell that this is where it's going to. So it's different for every family.
So sometimes we have parents in denial, like, no, my child can't have autism.
Oh yes, I've had parents sit here and tell me that, doctor, you are wrong. And I'm like, okay, we don't need to call it autism. Do you agree your child is not talking like a 3-year-old? They said yes. Then let's say your child has speech issues. Let's start working. And sometimes I give the diagnosis a year or 2 years into the intervention. When the other things have started coming out and they themselves are telling me, then we bring it out.
That's very interesting. So, I mean, as a pediatrician, autism is a disorder that's found, like, it's realized very early.
Yes.
So when you have a child, let's say, reach 18 years old, are you supposed to hand them over to another type of person, like another type of specialist? Because I know pediatricians deal with kids. Yeah. So growing up, what's the arrangements like?
It's tough. I have clients who are 25. I have even a 40-year-old who comes here because I don't know where to send them to. So I mean, ideally, what happens is that an adult neurologist who is subspecialized in autism can take over, or a psychiatrist can take over. However, not all adult neurologists are conversant with autism.
Yeah.
And if you don't start with it, everybody has their niche. Even in adult neurology, somebody is doing more of movement disorder, somebody is doing In Ghana, we have very few people who do adult autism.
I mean, I looked at the statistics, and even looking at specially abled kids, you look at the number of therapists available. I mean, compared to our population.
It actually is non-existent when it comes to the adult special population. So the closest people I work with is the adolescent psychiatrists and the adult psychiatrists. They are usually able to take on some of the adult clients.
So I mean, because the average Ghanaian mother will not, because speaking to other mothers who have kids with autism, I asked them what their sentiment towards autism was before they realized they have an autistic child, and they are like, they were indifferent. I mean, they had heard it on radio a couple of times, but for you yourself, what's attracted you to the field?
That's a very interesting question. Okay, so when I was in medical school, like you, that's decades ago, I wanted to do psychology. That was when we were level 200. So I wanted to do psychology. And then when I did my psychiatry rotation, I was like, I really love psychiatry also. And then I really wanted to work with children. So I knew I had to work with children. I wanted to do something in psychiatry. I wanted to do something in psychology, something with the brain. Okay. Then I ended up working a lot with Prof. Beidou. I don't know if you know Prof. Beidou.
I think I've heard the name.
Yeah, he's in Kolibuba. He's retired, so I think he teaches only medical school now. And Prof. Beidou is a pediatrician whose interest is in neurology and development. So I ended up working at the neuro clinic for like years whilst I was doing my residency. And then an auntie of mine came from Canada and said, there's a subspecialty that can get you to do most of what you want to do. So when I finally did it, I realized, this is it, because I do a bit of neurology. I do psychiatry, child psychiatry, I do psychology. I ended up doing a master's in psychology before. And then you do pediatrics. So, I mean, it's the best combination for me.
And I mean, you are doing really well. And today, I mean, we are here in Missions Clinic. And I mean, you should come and see yourself. It's very massive. The environment is very child-friendly. And I mean, it's everything you need. And to any parents who is really seeking help, concerning your child and everything, I mean, this is a place you can really turn your head towards and head to. And Dr. Marilyn, I'm so grateful that you've had me today, and I'm so thankful. And hope to see you soon. And so if you put the details of the clinic in the description. And thank you so much for joining us today. Bye-bye.
Bye.